Good morning and thank you for coming. As you said, my name is Amber Worthington. Today I'm going to be presenting a paper that I wrote with Roxanne Parrott and Rachel Smith, all at Penn State University, entitled Spirituality, Illness Unpredictability, and Math Anxiety Effects on Negative Affect and Uncertainty Management in Individuals Diagnosed with Alpha-1 Antitrypsin Deficiency. And before I get started, I do just want to acknowledge that this project was funded by the National Human Genome Research Institute of the National Institutes of Health. So first, according to uncertainty and illness theory, people determine the meaning of their symptoms and their illness based on the consistency or inconsistency in the number, frequency, location, duration, and/or intensity of their symptoms, as well as their communication with high-quality information sources like physicians. So when their symptoms present with sufficient consistency to form a pattern, they're able to form a cognitive schema about their illness in order to understand it. However, when their symptoms do not present with sufficient consistency to form a pattern, they're not able to form that cognitive schema, and this results in perceptions of illness unpredictability. So the genetic condition considered in this research, Alpha-1 Antitrypsin Deficiency, from here on out Alpha-1 or AATD, is classified as one in which the onset of clinical symptoms is in adulthood, the likelihood of development of those symptoms is variable, and it's dependent upon things like the environment, so for example air pollution, or different health behaviors, so for example smoking. In addition, an Alpha-1 diagnosis has a variety of different genetic mutations. So some of these genetic mutations are associated with more mild or moderate effects, and others of these genetic mutations are associated with more severe health effects or more severe symptoms. So an Alpha-1 diagnosis can have a wide range of symptoms, including fatigue, shortness of breath, or wheezing, all the way up to more advanced liver and lung diseases like emphysema or chronic obstructive pulmonary disease. So the genetic testing and diagnosis of Alpha-1 conveys the unpredictability that defines illness uncertainty, because an Alpha-1 diagnosis, while seeming to reduce uncertainty by providing a diagnosis for those symptoms, can actually convey a new set of uncertainties because of the unpredictability of the symptoms and the prognosis of the disease. So according to uncertainty and illness theory, it posits that cognitive capacities, or the information processing ability of the individual, contributes to judgments of unpredictability. So decoding communication about genetic test results oftentimes relies upon understanding health statistics or probabilities, as healthcare providers like doctors or genetic counselors oftentimes employ scientific statistics or probabilistic language when talking about what may have happened with respect to symptoms in the past or what may happen in the future. So patients thus require numeracy skills or aptitudes with probabilities, fractions, and ratios in order to understand the implications of different health behaviors or different medical treatments, with low numeracy thus impeding comprehension. So we specifically looked at subjective numeracy, which is an individual's perceptions of their own abilities with math, which is a concept that's closely tied to something called math anxiety, which is a tendency to feel nervous or anxious when solving mathematical problems or manipulating numbers. So math anxiety contributes to the avoidance of both content and situations in which understanding math is important, and past research has also shown that math anxiety inhibits comprehensions of risk probability information. So we looked at this anxiety about math as a cognitive capacity that might impact an individual's ability to process information about Alpha-1. So we therefore predicted that subjective numeracy is negatively related to math anxiety, and math anxiety is positively related to perceptions of illness unpredictability in individuals with Alpha-1. So beyond the realm of cognitive capacities associated with anxieties about math, we also looked at an entirely separate domain of spirituality. So past research has shown that spirituality is important in coping with and adapting to a wide range of illnesses, including, for example, multiple sclerosis, HIV/AIDS, cancer, and diabetes, suggesting that spirituality may serve as a cognitive capacity that bolsters an individual's ability to deal with unpredictability in their illness. In particular, the existential component of spirituality, which is the sense of life purpose or the sense of self in the society, which we've labeled as spiritual well-being, has been shown to be more important in coping with diseases than this religious affiliation component. We therefore predicted that spiritual well-being is negatively related to perceptions of unpredictability. So we also considered negative affect. So past research, specifically in individuals with Alpha-1, has shown that perceptions of unpredictability lead to negative affect. And more broadly within uncertainty and illness theory, this would suggest that these individuals are appraising this unpredictability as a danger, right? So we're looking specifically at that danger appraisal, not at that opportunity appraisal pathway. Additionally, past research has shown that less numerate audiences make decisions based on affective considerations, and math anxiety contributes to negative affect, as well as the fact fact that spirituality may contour these effects, such that an individual who has greater spiritual grounding might be able to lessen the degree to which they feel fear, anxiety, or worry in the face of an unpredictable illness. We therefore predicted that negative affect is increased by perceptions of unpredictability and math anxiety, and it's decreased by spiritual well-being. So managing uncertainty is associated with the desire to feel in control of illness-related symptoms and events, and to feel that everything will turn out positively. So this sort of wishful thinking. So past research has shown that negative affects, so fear, anxieties, and frustrations, are associated with an individual's desire to manage their uncertainty about their illness. So thus negative affective responses that arise as a result of illness unpredictability might lead an individual to want to manage that uncertainty, right, to reduce that uncertainty in some way, right, because we're on that danger appraisal pathway. And so to have a more positive vision of the future. So we therefore predicted that negative affect is positively related to uncertainty management, and we also predicted an indirect effect such as illness unpredictability would influence uncertainty management via negative affect. So this is the overall proposed theoretical model from the paper. And we also have one research question. So the genetic mutation in alpha-1 occurs in the serpina-1 gene, and the M allele for this particular gene is associated with normal levels of alpha-1 antitrypsin in the blood. However, there's a variety of different genetic mutations that can occur in that serpina-1 gene that result in an alpha-1 diagnosis. So for example, an MS or an MZ genetic mutation is associated with mild or moderate effects, whereas an SZ or a ZZ allele is associated with more severe effects. So we therefore wanted to consider whether or not any of these theoretical variables were significantly different in those individuals who had these different gene versions. So in order to test this model and this research question, we recruited participants from the Alpha-1 Research Registry at the Medical University of South Carolina. For this particular project, we analyzed data from 137 unmarried adults. The majority were female, the majority were white, and roughly half of them had genetic mutations associated with mild to moderate effects, and the other half had genetic mutations associated with more severe effects. I briefly have the measures up here. For the sake of time, I'm not going to go into them in too much detail. The measurement model did have good model fit, and as you can see, the reliabilities are all acceptable. So this is just a table of the mean, standard deviations, and bivariate correlations of the theoretical variables. And we use structural equation modeling with a full hybrid approach in order to analyze the proposed theoretical model. So 6 of the 7 hypothesized direct effects were statistically significant. The only path that was not statistically significant was this path from math anxiety to illness unpredictability, and the model did have adequate model fit. This slide just shows the results of each of the hypotheses in more detail. So again, all of them were supported except for hypothesis 2. Hypothesis 6 was the one that predicted an indirect effect from illness unpredictability to uncertainty management via negative affect, and we analyzed that using bootstrapping procedures with 2,000 bootstrap samples and bias-corrected confidence intervals, and that was also statistically significant. We used independent sample t-tests to analyze the research question, and we found that there was one statistically significant difference, such that individuals who had a genetic mutation associated with mild to moderate effects had higher perceptions of illness unpredictability than those who had a genetic mutation associated with more severe effects. So I did want to highlight just a few of our key findings in the discussion and talk about some directions for future research. So first, with spiritual well-being, we did find that negative affect and perceptions of illness unpredictability were lessened by spirituality. So clinicians are increasingly understanding the need to being able to communicate with patients about their spirituality because of a growing body of literature that suggests that an individual's spiritual grounding can help to bolster their ability to cope with and adapt to illness. So this research suggests that genetic conditions might also be an area in which that's important. Additionally, we found this indirect path from unpredictability to uncertainty management via negative affect, and this supports previous research, specifically in Alpha-1, which suggested that unpredictability leads to negative affect, and then another paper outside of Alpha-1 that suggested that these feelings of fear, worry, and frustration led to this desire to manage uncertainty. So again, managing uncertainty is associated with this desire to feel in control of illness-related symptoms and events. So these individuals, when they desire to manage this uncertainty, may engage in a variety of different communicative behaviors, including information seeking, either online or with clinicians or with other family members. So it would be important in the future to look at how it is that they go about managing this uncertainty. Finally, we did find that there is a difference in gene versions on illness unpredictability, such that those with a genetic mutation associated with mild to moderate effects had higher perceptions of unpredictability than those who had a genetic mutation associated with more severe effects. So Alpha-1, again, is this particular condition that's classified as one in which the onset of the disease can be delayed by different things or even completely stopped by things like health style behaviors. So they can avoid smoking or they can avoid drinking alcohol, and this will reduce their chance of experiencing any of these symptoms. So these individuals with this genetic mutation that's only associated with mild to moderate risk might be more interested in learning more about how it is that they can control their risk. Right? So it's important for these clinicians and genetic counselors to talk to these patients in particular about how it is that they can go about changing different healthy behaviors to prevent their manifestation of symptoms. So a couple limitations: it was cross-sectional data, so we're not able to make any causal inferences. Also, their generalizability of the sampling frame. So the majority of our sample was white, which does coincide with the biology of the disease, such that past research has shown that white individuals are more likely to have Alpha-1. However, there are individuals in other racial and ethnic backgrounds, so it would be important to examine these relationships in other groups as well. In addition, the majority of the sample was female, and while this does represent the Alpha-1 research registry, so the majority of people in that registry who had signed up to participate in research were female, and this is similar to other research registries, the biology of the disease does not coincide with that. So it will be important in the future to figure out a way to examine these relationships in other genders as well. So we looked at how cognitive capacities, including math anxiety and spirituality, might influence illness unpredictability, and then how illness unpredictability influences the desire to manage uncertainty via negative affect. Thank you.